Civil rights movement in the trenches of the battleground state of Ohio, city of Cincinnati.
A champion for voting rights.
We're going to bring you people that know about business. We're going to bring you people that know about what's going on in the tech. Put some soul into this whole tech thing that's going on.
She's a fighter for the people.
Welcome, Reverend Al Sharpton, to the show.
Congratulations on your show.
She's authentic.
We're bringing Joe Madison, known as the Black Eagle.
Congratulations on having the show. Nothing is more important than the local programs that engage our communities.
She's a proud HBCU grad. It's time for Alicia Reece's Soul Food, Food for the Soul, on Cincinnati's 24-hour urban gospel connection, Inspiration 1050 AM and 103.1 FM, WGRI.
And hello, everyone. I don't know why I'm getting feedback. It's hard when you're going live. For some reason, we've got something on the speakers here. I feel like the streamers now when you go live. All right. Testing. 1, 2, 3. Are we ready? Okay. It's hard when you're going live on radio, 2 radio stations, and you're on social media platforms, and you're live, right? And so now you know what these streamers go through. But we're here with Alicia Reece Soul Food, Food for the Soul, with a new look. We're trying some new stuff this year as we are in our 8th year for our show here as Alicia Reece Soul Food. And this year I'm celebrating 30 years in broadcasting, film production, and as well as radio hosting. So I started in college. So 30 years, we're going to do some great things. I'm super excited about our partnership that we've had with Interact for Health. We got a great show coming up. Mental health is the topic. And we're going to get into it in just a second. So tell everyone to get to the radio, 103.1 FM, 1050 AM. If you're following us on our social media platforms, we're asking you to share. We're going to get into it because mental health is real, and it's so many levels. And everything that you're dealing with right now. I mean, everything for people don't know where we're going as a country. Things are changing. Things are getting cut. People's jobs are getting cut. Senior citizens don't know what to do. We've got funeral after funeral after funeral. It's just a lot going on. Young people in school, it's no longer just, learning their ABCs and 1, 2, 3s. They're dealing with so much pressure. Parents, what do you do if your child is not talking to you? You don't know if you're getting through to them. It's just so much going on. And your health is your wealth. And so we're excited that every month we always do a segment with Interact for Health, dealing with your health. But first, I want to give you a couple of things. It is April, ladies and gentlemen. It is April. That is a wonderful month because it's my birthday month. So this month, just going to try to reflect as I get ready for my birthday coming up. But it is also Minority Health Month. And, we don't do enough to take care of ourselves. We really, really don't. We have to do a better job. And I'm talking to my own self. Okay. So April's a great month. It's my birthday month, but it's also we recognize autism as well. So we'll be talking a lot about a lot of different things during this month and other months coming up. But today we're going to be focused on mental health. And I'm giving y'all time to get to your social media platforms to share. And I'm also giving you time to tell people, get to the radio, because I've got some outstanding experts that's going to be coming up in just a minute. We got Schroder, the CEO of Interact for Health. We got Karisma, Hazel, CEO of Poppy's Therapeutic Corner. And then you guys know her. She's been on the show before. She's back, Dr. Shantel Thomas. And so we're going to have them in just a second. But just a quick announcement, young people who are looking to be employed for the summer. You know, my belief is always we have to get our job program to the youth before the street job program gets to the youth. And last year we did our kickoff or our summer youth employment and year-round employment, and we had 1,300 young people that were hired on the spot. Young people showed up with their resume, they showed up with their ID, they were ready to go to work. We were able to do physicals on the bus. We were able to do the work permit. I mean, it was phenomenal. And these young people deserve to be recognized, because when you do something bad, they always have it in the paper, on the news. But when you do something good, it gets quiet. And I want to just scream how great these young people were last year. This year, we're doing it again. We'll be at Jarrell Baptist Church in the West End. We'll have the 513 relief bus. We'll have the jobs with Talbot House and all the different entities that we contract with. So grandma, granddad, mom, dad, get these kids there. Get these kids there for our youth employment. And I believe we started maybe 15 years of age. But you bring your ID. They must bring an ID or a social security card so that we could go ahead and get them processed. We'll be on the parking lot, Jarrell Baptist, and also Hayes Porter School. So that's where we'll be. And we hope to see all of the young people who are willing, ready to go to work. We also have training programs that pay you. We're going to also have some jobs for college students when you come back home. So come on out. It's next Saturday, April the 12th. I don't want y'all to miss it. April the 12th. I'll remind you. Make sure you come out. We've got the jobs, and we're looking to connect with the youth. All right, now we're going to jump into our show. Mental health. There are a lot of people that sent me some questions, and we're going to get down to the bottom of it. First, I want to bring on Kate Schroder, who is the CEO of Interact for Health. And then I also want to bring on Karisma Hazel, CEO of Poppy's Therapeutic Corner. Hopefully they start coming up on our screen. And Dr. Shantel. I know they're in the waiting room, but we want to get them up and going. And we'll bring them in a second. So hopefully they are ready for you. We're in two different rooms. So there we go. Here she is, the one and only Kate Schroder.
Hello.
For Health. Kate, now, there she comes. Karisma, you're on here. I mean, this is a powerhouse show. And then, Doc, everybody's been waiting on you, Doc. They've been waiting on you. The last time you were on here, I couldn't even get out of the studio. People were calling me. Did you ask her this? And you forgot to ask her that. So we have you back. We're going to start off with Kate Schroder, CEO of Interact for Health. And Kate, talk a little bit about Interact for Health, what it is, what it does, and why mental health is at the top of your list to battle.
Yes, thank you, Alicia. It's awesome to be here. And 30 years is amazing that you've been broadcasting.
And I'm only 21, people.
That's right. I don't know how math works. I have no idea. But Interact for Health, we're a foundation that's been around 28 years, and we support the 20 counties around Greater Cincinnati, and we are laser focused on how do we improve health outcomes for everybody in our community, and particularly the areas where we have the greatest gaps. And that is why mental health is one of our top priorities, because we are across all of our communities, and especially in our communities of color, in our rural communities, our LGBTQ plus community, we are having consistent rise in mental health challenges. And I think, like all of us, like, mental health is health. It is part and parcel. You cannot separate it from physical health. It influences how we show up and how we feel every day. And it is especially an issue among our youth right now. And so that's the way we work as a health foundation, is we not only help provide some resources towards the challenge, but when we have a community challenge like mental health, rather than all the organizations tackling it in their own way, we do our best to help be part of a collective effort where we can come together as organizations and say, what is our vision as Cincinnati for improving mental health and well-being, particularly among youth, and how can we all sort of add to that together? So we're excited to be here today. We're part of a big effort called Hopeful Empowered Youth that really is bringing together over 200 organizations in our community to improve mental health and well-being for youth over the next 10 years.
That's awesome. And one of the things I love about Interact is that you're going to be looking at measuring, and then also, because it's not one dimensional, and there's different areas, and so you'll be able to help break down like what are the areas that we're making progress and what other areas we need to make progress. And so that brings me to Karisma. How are you? And now you have a therapeutic, you call it the Poppy's Therapeutic Corner. What is that?
Absolutely. Well, first, thank you, Ms. Reece, for having us here on the show and opening this space. And to my colleagues in this work, it is such an honor to be here with you guys. So yes, we are Poppy's Therapeutic Corner. And so we are a group mental health practice. We are minority owned, operated, and staffed. And we serve our communities via mental health therapy. We do individual therapy, group therapy, family, marriage counseling. We also do have medicine management. So we have a psychiatric nurse practitioner on our staff to kind of help our clients there with medicine. And then we also have community-based case management services. So our case managers are out there in the community meeting our clients and their families where they are. They are looking for resources to really kind of help them, really eliminate kind of those day-to-day limitations. And then they're also working with our clients on basic social, emotional, and behavioral health skill building as well. So that is the gist of our organization. We do have 2 offices. We have one in the Springdale location, and then we also have one in the Dayton Kettering area. But of course, kind of as Kate said, we are out there really serving and working with the youth as well. So we are partnered with 2 school districts here in Cincinnati. And so we have a couple of schools that we serve, and just really, our primary focus and goal is to just be of service and to really help our communities live a more efficient and effective life.
That's awesome. Now, what are the schools areas that you're in?
So we are partnered with Rockdale Academy. We are partnered with Withrow University High School. We are at Carson Elementary. We are in Mount Healthy South as well. And we are partnered with Purcell Marion High School.
Awesome. Well, I have to, throw in Withrow, the greatest high school.
Okay.
I'm sorry, I didn't want to do it. They made me do it. I wouldn't want to.
Absolutely. Go right on ahead.
Dr. Shantel.
Yes.
Oh, my goodness. You've been on our show several times, but tell people who might, be meeting you and hearing you for the first time exactly what you do and what you specialize in.
Okay, so most people know me for owning a Sound Mind Counseling service, where we as well are a group of mental health, primarily African American practitioners, and we are here in Cincinnati, as well as I have an office in Westchester, Ohio. And so we are in the school systems as well, do some work there. I also am an author, so I wrote a book called Life is Grand After That Man for women recovering after breakup of a relationship, and trying to get that out there. So if you want to come back on and talk about how women can recover and after that breakup, divorce, or bad relationship, there's good guys out there, but there are some we need to get past. So I've written that book, and so I'm an author now. And I also own, I guess I should say I'm the executive director of Center for Healing the Hurt, which is my nonprofit I started about 5 years ago. And that's where I met Kate, and they have actually funded me, given me a grant to do this work that we are now doing. So I have another group of therapists who are now working in the nonprofit sector, and we provide trauma counseling and peer-to-peer trauma training for kids and teens in Cincinnati Public Schools. So we are currently, we have worked with Hughes, and we have worked with Withrow. We worked with Don in the past when a few years ago. And then we also have worked, currently we are in the Promise Center and Schroder. And so that's where a lot of the therapists are. And we're teaching those kids how to self-regulate, use mindfulness. We assess them for trauma, and we give them 4 assessments to see if they have experienced the trauma. And if they have, then they receive free services. And also with our peer-to-peer trauma training, we're teaching them how to look for, the warning signs and tips in their friends, and training them and educating them on how to have the conversation with their friends around trauma, because the research says that kids will go talk to their friends and tell them about their trauma before they'll go to an adult. So we're educating them and teaching them how to have that conversation, then lead them to a safe adult that they can talk to about the trauma.
That's excellent. That's we got to have you back on that show about that man, because that could be a whole show. Whole show. But I want to start with this question that was posed to me. People want to know, is mental health hereditary? Or I guess, I don't know. Is it hereditary?
So basically, just like anything, like you can have a predisposition to, cancer, and if there's in the family, or diabetes, or heart disease. The same thing is there when it comes to mental health. So you can have a predisposition. And so I think of it as, like, the research talks about 1 in 3 kids, if there's a family of 3, they might end up with depression, or 1 in 4 could have anxiety. So in that family, because again, it's a brain issue, right? So we have the serotonin levels, dopamine levels are not where they should be. And so therefore you have some situations or concerns that come from that. And so without that medication, if people need the medication, then yes, it's there, and it is in a part of the bloodline, and it can be hereditary. So I can have a predisposition to be depressed if my mother and father have depression, just like with drug addiction and alcohol. If your mom was addicted to alcohol or drugs, the research says you have a 50% chance. If your dad and mom are, there's a 75% chance or higher that if you choose to use drugs or alcohol, you may become addicted. The same thing is present when it comes to mental health. So yes.
Wow. And then the follow-up question they had from that, because particularly in the Black community or community of color, they didn't really deal with this years ago. So how do you trace that? They weren't talking about depression. They weren't talking about anxiety. They didn't have the words. It was kind of like, just suck it up and keep moving. So if you had that before, maybe with your grandparents or parents, how do you know now that maybe I need to check on this? Do you have to have a symptom, or should you, be proactive?
Well, I can jump in on that one. So, I would definitely say it's all about awareness, right? And it's all about really kind of educating yourself and your friends and your families about maybe what some common symptoms are. And, I think when the pandemic hit, we kind of saw a wave in mental health, because it began to really, kind of get out there, and people were like, man, I feel like, oh, these days are so long, or they're dark, or what have you. And then you saw people kind of come together to say, oh, wow, I might experience this too, or this sounds familiar, or in my past history, this looked like that. And so it's like, wow, this is a whole thing. And so I think it's just really about understanding and being aware of what some common signs and symptoms might be. There's no harm in really, getting kind of screened for mental health and really being proactive with that. And if there, maybe there might not be a mental health disorder that is present, then that's wonderful. How do we prevent that, right? And so therapy can also kind of work in that perspective, to really say, okay, how can we prevent it? Let's get you educated and aware of what that looks like.
Mm-hmm. And one thing that I say to my clients is that every year we go and we have our physical health checkup.
Yeah.
So we also need to go and have our mental health checkup every year, because one time I had a client in 1 year, He lost 12 people in a matter of 4 months, very close. His mom, his dad, grandparent. So all of these close people relationships, he was grieving. And so he had compounded grief. The year before, he was fine. He came in because he was going through a breakup. But, so from year to year, it's just like our physical health can change, our mental health can change. And so, yes, we need to have the conversations. We need to stop saying what's said in this house stays in this house. Nothing's wrong with you. Pray about it. God will take care of it. I mean, God gave us therapists for a reason. There's God for prayer, but then there's therapy for this earthly healing that we need.
Absolutely.
So be okay with saying, hey, something's going on with me. I don't feel well. I'm crying a lot. I'm not sleeping well. I'm irritated. My stomach is upset. That's not normal for me. So I need to go talk to somebody and see if there's something going on.
Mm-hmm.
Yeah, we're talking mental health, and there's so many layers of it. It used to be just a stigma, right? Mental health, if you need to, maybe have to be taken away, or mental health when you have to just be on medicine. But there's a lot of other components. There's so many levels. In particular, I think the stress levels are a lot higher now. Kate, as a mom, someone having to take their child to therapy. Talk to us about that, because I know that's another thing, just like Dr. Thomas said, a mother saying, or father admitting, like, wait a minute, I had to take my child, they need help. How do we break that stigma, and what does a parent have to go through?
Yeah. And I have kids now that are in 6th and 4th grade. So it's real what's going on. I think just to build on what we were talking about, one of the real challenges in mental health is in part because of the stigma. We wait till issues become very significant to be able to go and get treatment. And at Interact, we're often thinking about, like, what are the policy changes? Like, where can we affect change? And we talk about parity between mental health and physical health, and prevention is so important in both spaces. Like, as Dr. Thomas was just saying, for my kids, I get 2 dental visits a year, no matter what, that are covered by insurance. I can take my kid to the pediatrician once a year, covered by insurance. Nothing is covered for mental health until you have a diagnosis. So that ability to go and actually have a check-in, because it's not black and white. Stress builds, and also it builds, helps to address the stigma when we're talking about, how are you feeling? Why are you feeling it this way? We are so lucky in Cincinnati. My kids go to a Cincinnati public school, and as Dr. Thomas and Karisma were just saying, every school and their partners in many of them has a mental health provider. Many parents don't know this. So my daughter recently asked me, back in the fall, I want to see a therapist. She knew the name of the therapist at the school. Mindpeace, Cincinnati.org, you can go on, see which partner is your school's partner, and reach out and get an appointment through that. And it's an amazing resource for our kids, because they can be seen during the school day, which is when it makes it easier and more accessible for parents. But the funding is still an issue, because it is not until a child has a diagnosis, it still becomes a payment issue, where the parents have to cover it.
Wow, that's something to think about, because like you said, if we're dealing with preventative, which I think is where a lot of people are, right now, they may go into a depression. Maybe they lost their job. Maybe, they've got, like you said, a lot of deaths. Dr. Thomas, talk about that, because it does seem like, for me, I'm going to a funeral every week, sometimes twice a week. We just lost, as Kate knows, Francie Pepper. You go on your Facebook, you say, oh, not this. Francie Pepper, did a lot in this community and was a force. But then we had lost Gwen Robinson. I just came from her funeral, the week before that. And we've got people like Bernadette Watson, who had lost her son, and it's been just hard to deal with that. Or Fanon Rucker, who lost his son. So talk to about the death part, because, I know when I lost my mother, and they say, oh, it was years ago. It's still tough when her birthday comes around, or something like my birthday comes around. I'm like, man, I really would love to talk to my mom and ask her about some of these changes, you know, as I get older with my body. Hey, did you go through this, Mom, or did you? But I can't do it. So can you talk to us about how to handle all these funerals?
So, you know, the thing is that when we deal with grief and loss, there are certain time frames that we are given. And so through the training that I've had for grief and loss, the research says that, of course, the loss of a child is the most difficult loss that anybody will deal with in life. So it takes 9 to 11 years just to get to acceptance for a parent when they have lost a child. Say, okay, now I can accept that my child is gone. The loss of a parent can take 7 to 9 years because, again, our parents are with us our whole lives.
Right.
With your child, you don't expect your child to pass away before you. And then with siblings and relationships, it could be even a loss of a pet, 3 to 5 years before a person can say, okay, I'm okay with that pet. And so we don't do things like try to replace the pet or tell people you can have another child, or, oh, well, they lived a long time. Your mom was 94. You know, she lived long. So
I know people say that, like, oh, they lived to be 94. You'd be like, but I wanted them to make 95. And if they could just get one more year, 99, you just don't want to let them go.
Right. Yeah, it's like, I want them forever. I want my mom to live forever. I want to live forever too, you know? And so it's hard, but when we have to deal with loss after loss after loss, that's the compounded grief. So we have grief on top of grief. And so you think you get over one loss, and then here comes another, and then here's another. And so we're constantly grieving. So we all have to learn our grief cycle, know your grief cycle, and how long do you. So when my father passed away, my grief was postponed because I had to be the daughter who was in charge and tell everybody, you know, do this, let's get the obituary together, let's plan this. And so I didn't start my grief cycle until 2 months later. And so sometimes people say they're not grieving well, or they didn't cry. Well, we don't all cry. Some people may. My uncle, he redid his whole house when my grandfather passed away. New lighting, new floors. And my mom was like, what's going on with him? This is the way he's grieving. So we have to understand when we go to a funeral, so we hear about the loss, we begin grieving. Right. And so we might have that 3 to 7 days, which they say is the initial shock, denial, you know, bargaining, acceptance. We don't get to acceptance sometimes for a while. But on average, those first 3 to 7 days, the blood rushes to your brain. You're trying to process what's going on. So we're not in our right frame of mind. So we have to give ourselves that first week to get back to saying, OK, this just happened. Now I'm trying to accept it, but I'm still not quite there. And then if we go to that funeral, know that once we hear about the loss, and then a week or 2 weeks later, we go to the funeral, now we're dealing with the loss. Now we're going to have the grief again. So we have another phase of grief that we go through. And after that, usually up until that first month, we're still grieving. But when someone loses a husband or a wife, a child, or like I said, a pet they've had a long time, they may grieve for months, again, years. And so we still have to check on them, check on ourselves, say, hey, am I doing okay? We have to be I always say, heal yourself. You know, sometimes you got to deliver yourself and you have to heal yourself. So you have to say to yourself, am I doing well? And if I'm not, there's good grief and there's bad grief. Good grief is I allow the emotions to come and go, express them. I tell people, hey, I'm okay today, but I'm not okay tomorrow. You know, the next day I may not be, I'm not okay. I am okay, but I'm not okay. And then sharing that, being honest, dealing with the emotions. There's over 52 you can have. Or bad grief is, don't talk to me about it. I'm not going to deal with it. I'm not selling birthdays, holidays, Christmas. I don't even want to think about them. So which one are you going to go through? Good grief heals you. Bad grief does not. So
wow,
helps.
Wow, Karisma. Now, I want to stay on this grief piece because we've got teen suicides are up. You know, whether it's a suicide or whether, you know, like Dr. Thomas said. I mean, with my mom, they say, I remember someone said, she's been gone that long, you should be able to move on. I'm like, no, I have a void inside me that just can't get filled. And I've been trying to fill it some kind of way, but it just won't, because, you know, she's gone. And then when I see other funerals, I relive the trauma. You know, people say, oh, are you going to make that funeral? Because, you know, the trauma is, I know what the people got to go through. Yeah. I know they got to go through this pain, and I can't help them stop the pain. And I know their family's going to go through this or whatever, all those different components. And then the other thing I realize is, wow, there'll be other people in my life that I got to go through this with again. You know, my family, either I'm going to go or they're going to go, but I don't want to go through it anymore. Yeah. Talk about the talk about the therapeutic corners and what can be done when people are, have experienced loss themselves. Like you said, it might be 9 years or 11 years or what have you. How do we get through it?
Yeah. Well, I think it's important to note that grief is a process, right? We have different stages of grief, and at any given moment, we can relapse to a certain stage in grief. As Dr. Thomas said, you have the bargaining stage, denial, you have acceptance, you have the anger stage, you have all these different stages here. There are 5, and so you have those stages, and you might actually go through each stage for a certain period of time, and you have to allow yourself to do that. I think one of the biggest things is giving yourself permission to not be okay, right? It's okay to not be okay. I will be very transparent here. I'm going through the same thing. I just recently lost my mother this December, this past December. And so, thank you. And so, you have to really allow yourself to feel and understand that, again, it's okay to not be okay. And so being educated on what those stages of grief look like and what signs and symptoms and things like that of being in that stage looks like really helps, because you can, in therapy, you can learn some coping skills and some strategies to really help you navigate that space. I'll be, again, very transparent, right? There are times where I'm angry and I'm like, oh, this just happened, and I have to get up, I have to go to work, and I have to do this, and I have to do that, and then the next day I'm like, I just want to lay here. It takes me forever to get out of bed, and then the day after that I'm like, okay, but I understand, I gotta move on. And it's a wide range of emotions. It's a wide space. And so just really understanding how to navigate each space and being equipped with the coping mechanisms and tools and strategies to navigate that space it's very essential.
Wow. Now, Kate, with Interact for Health, one of the things is people don't know where to turn. I had a mother who reached out, mom and dad, they've done everything for their children. They feel, what I'm saying, making sure they provided, and, middle class family, all of that. And they have a daughter, heavily in sports and doing sports, but then all of a sudden started just, easing back and not talking, going to play their game and shutting the door. And, they don't know, of course, you want to have discipline, right? But how far to discipline, because they said, the kids are different now. I don't know if they would have survived my mama back in the day, Barbara, but they're different now. And, I want to make sure we have discipline, respect, etc. But now they're not talking. And like Dr. Thomas said, they're talking to maybe their friends, and the friends that, they don't have a lot of experience to give good advice. And so now they're nervous because, so, one of the things is, where do I find information to take my child to therapy? And Interact for Health, I know, has been working on having a place where people can find those resources. You want to talk about that?
Yeah, I think we have 2 sort of central hubs right now in our region. One is in the Cincinnati, Ohio side of the river. Mind Peace, Cincinnati.org does have a hub of resources where you can search for therapists, but also a lot of resources around trainings that are available to parents. FindHelpNow.org in Kentucky is a similar search where, based on if you have the type of issue that you're having, can also help. I think as a parent that's going through this myself, I think there's a few messages that really resonate with me. One is the mindset that often we think like the child is the problem, or the kid. The reason we're seeing all these rises is that there's something wrong with kids today. And the research shows it is not the kids, it is the conditions around them. They are growing up in a much different environment than we all grew up in. The information available to them, one of the interesting sort of research and trends that have been following is like puberty hits kids earlier these days, especially girls. And that is the the part of their brain, the back part of their brain that is very hypersensitive to emotional information, comparative information. And the information that they get on what they're missing out on in social media is like exponentially greater than what we grew up in. And yet their frontal lobe, their executive function, is not developing any faster. And so you have this mismatch where they're being inundated with all this information that can be stressful and comparative, and it's 24/7 in the middle of the night. They're seeing what their friends are doing on Snap, and like we're their adults are that help them with that frontal lobe part. And so in making those decisions. So I think a lot of it too is just having that empathy and understanding, learning how to be there and talk to them without judgment, and with patience. And it doesn't always have to be the parent. I'm not always the right person. My daughter speaks to some of our other family friends a lot more openly than me. And the research shows it is having like one caring adult in your life can make a tremendous difference. In the LGBTQ plus community, it reduces the risk of suicide by 40%,
Wow.
which is amazing. And so we can be that for other kids too, in our communities and in our churches, in our extended families and neighborhoods. I also really like the website sounditouttogether.org, has a bunch of resources for parents on how to ask good questions, how to start those conversations with your kids. It's a national website that is researched. And then of course, 988. That is for anyone who's in crisis. It's 98. It is a phone number like 911 that is there for any time you are experiencing a crisis, and they can, in our region, they can either respond mobily or it's a someone on the line who is trained therapist to respond to needs.
Yeah, that's a big deal. 988 is really big, and I know Hamilton County taxpayers went to the polls and said, "Hey, we want an increase for mental health," because they understand how important it is. And I know that we had ARPA money. We put more funding for that, anti-teen suicide prevention, the 988, the quick response teams. But I think one of the things I wanted to that I'm learning is not a one package. You know, it doesn't fit everything in one package, and it's constantly changing. The way we receive our information. People now say that, you know, Kendrick Lamar says, turn the TV off, and it's for real. You know, some people got to turn this off because it is really scary. And I'm seeing more people just feeling like there's no way out. Can someone talk about social media, how it affects, not just, it affects teens and it affects, you know, everybody, because if you feel like there's no way out, then sometimes you can get all the way to the edge. So can we talk about what social media, and if there's some strategies that people can use to help them? Of course, I want them on social media looking at me, of course, but no, I'm just kidding. But on the real side, there are times when, you know, you turn it on and all I get is somebody has died, somebody got shot, or somebody done lost their job, or they're getting ready to take this away or that away. It could just be overwhelming. So are there any tips? We've got the websites. We're going to put that on our page, Alicia Reece Soul Food, so people can get to Kate. I think that's very important. Parents getting training, you know, but is there anything that a person watching or listening, maybe one or two tips that they can deal with as it relates to social media and what it is doing with, you know, that's the way, this is the world now, and it's affecting the kids, it's affecting the adults, and it's affecting mental health in some cases.
Yeah, I would definitely say social media has a really huge impact, right, on the way that we think and the way that we feel, the way that we perceive things to be. So some boundaries that, or I should say some tips, I should say, that, you know, you can definitely put in place is really setting your boundaries, if you will, with social media, really kind of filtering what it is that like you're looking at, and also how often you're looking at it. So, you know, I think really a good strategy here would be before bed, try to stay off of social media for at least like an hour to an hour and a half, right? That way, you know, when you lay down, your mind isn't going, it isn't continuously thinking about, you know, the day or whatever you looked at on social media. So again, really just setting those boundaries and filtering out the type of information that's showing up on your timelines and the type of information that you're allowing into your space, as well as setting those time limits on social media could be very helpful.
Yeah. Now let's talk about the stress of the beauty part of things, right? And men and women, not just the beauty, but you go on here, and I mean, it stresses me out. And it looks like somebody went to bed and they woke up, and my goodness, they're in shape. They're, you know, and while I'm over here eating a cupcake, and they are in shape,
And
they're
my
running,
chips on the couch.
and chips on the couch, and all those kind of things. But talk a little bit about that, because that's another thing in terms of image, right? Image, and it affects, you know, our younger people. Everybody, you know, feels like, you know, I've got to go get plastic surgery. I need a BBL. I need this. I need that. I'm not rich. You know, because they look at these celebrities, and of course on social media, it shows all the positive. It doesn't, you know, nobody wants to hear about your negative on their social media. So tell us about that, because that also shapes young people. Young men feel like, you know, if I'm not a millionaire, I'm nothing, or I'm not the popular guy. I don't have or I'm not the popular girl. We had that growing up, believe me, peer pressure. We had it, but now you can look at peer pressure worldwide, right? It used to be just in my school, you know, or in my little community. Now I can see, man, they're in Miami, they're on a yacht, they're over here, they're in the Bahamas, they're over there. Tell us about how that has played with mental health, because even people look at other people's lives sometimes and say, man, they got a house, they got this, they got that, they got a great marriage, they got great kids, and man, look at my life. Talk a little bit about that, and what people can kind of do to try to, you know, deal with that from a mental perspective.
So I have talked with my young people. There's this group that I do, especially with young ladies, called Lovely Me. And one of the sessions is on that whole comparison and the images that you see out there, the influencers. And I have them research how many people are actually influencers and making money from it. And when they come back and they say, oh, I only found 3, but then you look at 250 people in the day that they're following. One girl said one out of the 250 that she was following. So it gives them an idea or the reality that everybody is not living out, making all this money. They might throw some money in the air and make it look like they're having a great time, but they might their whole month's rent on that, you know, one time to show that they're living this way. So I think we put it back into perspective. Have the kids do some research on, you know, what is actually real and what is make-believe out there in social media. And I also tell my parents that at the end of the night, you know, you're still the parent. So however much time they get, whether it's an hour, some of my parents will say, well, the kids have to do their homework and then they can have an hour of social media. Some say if they're 15 or 16, they get 2 hours. So they're learning to limit it, the exposure, so they're not always having that comparison syndrome of what this person is doing on social media or my friends here or there. And so it's not coming in as much. So it's still up to, I think, the adult to be the adult. And limit that exposure. I had one parent, when we first started working together, her son, he wasn't even coming out of his room after school. He did his homework, ate dinner, went to the room at 6:30, and they didn't see him until the next day because he was on, you know, whether it was on the game with the friends or he was scrolling. So now he's more engaged, but he also didn't have any social skills because he was not engaged except for on, you know, the video with the other kids. So the social media part, what I found is that we have to put everything back into reality, make sure that they know some of these things, people are just standing in their kitchen, putting all these backdrops, making it look like they're big and bad or whatever they do. Some women, you know, I've seen it where one leg is skinny, one leg is fat, and you have to show them. I had to show the little girls, like, look, what's different? This leg is skinny, this one's fat. Oh, that's been photoshopped. So they can see that everybody that looks beautiful. And then when they go through those transformations of the woman doesn't have teeth, has, you know, all the blemishes on her skin, and then she puts on, you know, 7 or 8 faces of makeup and she looks like a whole new person. I'm like, but when she takes that off at night, do you think the guy is looking, is she sleeping in that? Or does she take that off? And is this reality? You know, or is it not? So making them see that these things are not real. And some of the kids get it, but some still are like, I want to be like that. And I think as they get older and the parents keep helping them understand, everything that glitters not gold, then they will have that, I don't want to attain to be, I'm going to be an influencer. You hear more of them saying that. I'm going to sit at home all day and make content. And then some of them, I say, well, let's try it over the weekend. That's one of their exercises. Over the weekend, I just want you to keep posting. They're like, I'm tired. I couldn't stay up, because these little girls are thinking they're just going to post and sit out. I was hungry. So, when we give them these reality checks, it's a whole different ballgame. They're like, I'm not doing that. I'm going to college, so it's up to us to still, make it an exercise at home over the weekend for your family and see what happens with your kids.
I love that. We're talking Dr. Shantel Thomas, Karisma Hazel, and Kate Schroder. We're talking mental health. It's Minority Health Month, but this is for everybody because it can hit anyone. And let's talk a little bit about as it relates to the economic stresses of the world, because that seems to be another component that really hits hard. You just can't, you feel you can't make it. I had a woman tell me, I just can't make it. It took me 3 months to get the job. I got the job, and then the company got bought out and got rid of my department. And now I'm going through bankruptcy. I've been dealing with that. Now they trying to lose my house. But it takes, 3 or 4 interviews, right, before you get the next job. Talk about how does a person get through that and try to still maintain the mental health and not want to give up?
Well, I'll jump in. So, it's something that you say that I have like 4 people that I know who have gone through layoffs here recently with, the economy changing and, some of them working for different places. I had a person come in and said, I'm grieving because I had to lay off 52 people that I have worked with over 25 years. And so the grief is not only on the side of the person who's losing the job, but the person who has to do the laying off as well. And so you have to develop friendships and relationships. And so there's loss, there's relationship loss, there's financial loss, there may be a loss of a home or a car. And so what I have learned to say and what I think has become comforting over just the past 6 or 7 months is that, if some people have a savings, they may have that 4 to 6 months of savings, some may not. And so I say to them, let's draw a circle, you in the center. Who is your support? Who can you go to that can help you financially? Because if you don't have money to even buy a meal this weekend for you and your kids because you've been living paycheck to paycheck, who do you know that's your friend that can help you? Maybe they can't give you money, but they can give you a meal. Or maybe they can't, feed all of you, but they can say, hey, your daughter can come up here and spend a night with me. So we develop a support system, and we have to think about that. You cannot be too proud to beg right now. You cannot be too proud to beg. You have to say, I need help. We don't know. A closed mouth does not get fed. So if I need financial support, I tell them, think about who financially can help me, who can help me with food, who can help me with shelter. And before they know it, they come in and they say, I don't have anybody. By the time we finish, they've got 35 people on the list. Like, oh yeah, I forgot my girlfriend who lives in LA, or my one girlfriend. Oh, she's the head of this company, and she told me if ever I needed anything. So the moods change because I come in depressed and sad and anxious. By the time I leave the session, I'm feeling encouraged and strengthened. And now I know I have more support than I thought I had because I was just looking at me and these 2 friends. Now I have a list of 35. So we have to start realizing that I have to say, I need help. And I have to think about who is my extended support. I told one of them, I said, go through your phone. How many people do you have in your phone? She said a lot. And then by the time we only got through the B's, and she had 200 people. We only got through the B's in her phone, and she had 200 people that she had written down. And these were all people that she felt like over the years, she had developed her network, and there she could ask them for something, And so we have to begin to realize that, yes, the times are hard, but yes, there is a support, your church family, your girlfriends, your cousins, your sorority, fraternity sisters, the people that you work with. Don't be too proud to ask for help. Now I said beg, but the song says I ain't too proud to beg. That's a song. But I'm just ask for help. And don't be prideful. Pride comes before a fall. If you want to do something and do it well, open your mouth and say, hey, I need some help. I need some support, whether it's mental help, financial help, whether it's, help with that mortgage or your children or with your marriage. The help is here. You just have to let us know you need it.
Absolutely. Now, Kate, let's talk about the health component. You had a major health scare at a young age. And at that time, you're like, hey, I got my ambitions, my dreams, I got my goals. I'm a runner. You're a runner. You're health, doing everything right. And then this hits you with cancer. Talk about that and how health can change also, because something hits you and you're like,
Mhm.
how do I keep my mental health? I remember them telling my mother, you got stage 4 cancer, and by the way, you only got a couple months to live, but don't stress out. And I was sitting there like, what are you talking about? So talk about that, because health can also alter a lot with your mindset too.
Yes. And it really builds on what Dr. Shantel was just saying too. Because I was 33 at the time, living in DC, living my best life. Right, I was very stressed with work, but had a great apartment, a great job, and then noticed these lumps on my right clavicle here, and I thought, no big deal. This must be swollen lymph nodes, and I had the flu. The flu went away, and I kept having these lumps. And a month later, I actually showed them to my dad when I came home for Thanksgiving, and he was an oncologist. And I was like, Dad, what do you think of these bumps? And he said he felt them, and he felt the back of my head, and he said, this is the classic presentation of lymphoma. And of course, I was 33. I'm like, Dad, don't worry, this is what you see. But he was very just a non-alarmist person, and sat me down every day. I was like, you're going to have to get scans in Cincinnati on Friday if you want treatment here, or get a Monday in DC. And I was like, okay, Dad. And I did. And it was Hodgkin's lymphoma. And I had to go through 4 months of chemo and lost my hair. And it changed my life in incredible ways. But as Dr. Thomas was just saying, like, the biggest lesson for me out of that was I had to ask for help. It was the first time in my life since being an adult where suddenly, like, I wasn't in control of my fate. And being accepting of that was almost... it gives you a sense of clarity when you're like, okay, the day before I got my diagnosis, I still had, 50 things that were stressing me out about life and my job and all this. And all of a sudden it becomes, okay, my only job is survival, and I need help. My friends came in for every chemo treatment and went with me to get chemo at the hospital. And we made it joyful, and it was the help, and they found joy in being able to help too. That's the other thing, that, not being too proud to ask for help. Like, it's a gift to others who also find joy in being able to help. And all of us need help in different ways in our lives. And so I think it gives us the mental health support that can help us get through physical health challenges as well.
That's great. And Karisma, you said something that that got me. You said you go out to people, because sometimes people might feel a little more comfortable if you're coming into their setting versus you going into, people say, well, I don't know but when you come into their setting, do they kind of open up a little bit more, a little more comfortable to be vulnerable?
Yeah, absolutely. Right, because they're in a space that they feel is comfortable to them, and that they feel is their safe place. And so we do find often that people are more open to services, and more open to their journey, if you will. And something that really ties into what Dr. Thomas shared and what Kate shared, and Kate, thank you so much for sharing your story with us today. One thing that helps, in addition, again, to what they said, is really understanding what motivates you and what your motivators are. And so oftentimes, we understand that there are situations that we really can't change. However, how do we help support the person going through the situation? And in addition to finding what their support system looks like, we also really help them determine what motivates them. Let's write that down. Let's put that in a safe place. Let's keep that close to us. So in the event that, we feel down, we feel like we want to give up, we feel like there's just no hope, we can look at that and we can say, okay, but this is the person or the thing or the place that motivates me. This is my ultimate goal. So let me have that visual there, and let me continue to push forward. And so oftentimes, again, when we're working with clients in their own spaces, we're able to really help them determine that and feel that with them and for them.
Yeah, I think that's that I thought that would just help people, like you said, break the ice and come in. Now let's talk about the strong people, so-called strong people, right? And we're seeing more of those folks. The young lady, I think she was Miss USA or Miss America, looked like her life was just so wonderful. She got her dream job. I think she was on one of the national shows, maybe Entertainment Tonight might have been it. She was living in New York, a beautiful woman, and she jumps off the top of the building, and she left a note. And I think her mom has a book out. But let's talk about, they always say, check on your strong friends. Now, you ladies are strong women as well. You also have a teen that might be strong, right? There may be a teenager that says, oh, they're the straight A student. They're the ones that's always, doing well. They're driven. Or you might have the person that, oh, they have the best personality. They're always smiling. They're always laughing. They always bring joy to the room. How did this happen? Someone talked to us about the quote unquote happy / strong person and what they might be going through as it relates to mental health. Yeah. And how do we help them?
As you talked about that, Robin Williams came to my mind. He was the happiest in the world and depressed and committed, death by suicide. And Don Cornelius as well. Yes. These people we see all the time and we think, man, life is great. But we never know what somebody's dealing with behind closed doors. And I went to a training once and they said, we have to ask the hard questions. Are you thinking about killing yourself? And say it just that way. And most people will say yes. But we are afraid to ask that question. So we, the community, have to be okay with saying, this is a tough question to ask, but I'm going to ask, are you thinking about killing yourself? I had to ask that to one of my girlfriends a few years ago, and she said, yes, I am. And I was thinking about doing it this weekend. Changed my life, changed her life, went into action mode, close friends. So sometimes you're so close that my training went out of my head, because this is my girlfriend that I love. But I knew I had to get her to a safe place and had to get her connected. And so we have to be okay with asking that question. And then we have to say, let's look, does everything look well in her life? She was married, successful, had her own business, kids doing well in school. Nothing seemed wrong. But she said, everybody sees what I want them to see. We're masking. So, as people say, you're that representative that shows up. We're not being our true, authentic self. If I'm hurting, I need to say, today I'm not doing that well. I'm in a little bit of pain or I need help. Again, we have to ask for help. And sometimes we, the community, have to say, what do you need and how can I help you? Mm-hmm. What do you need? And that they'll tell you. And then how can I help you? And people will tell you. But we have to be okay with asking those difficult questions. And then if we ask, what do you need? You better follow through with the need, Come on now. You just asked me what I needed. I said, hey, I need you to come pick me up after work and show up for me. So we have to show up for people. And so people have to become comfortable with sharing what I'm hurting. Today's not a good day. Tomorrow's going to be better. But today, right now, in this space, I'm not doing well. We can't continue to smile. As Langston Hughes said, we wear the mask that grins and smiles. It hides our cheeks and shades our eyes, or something to that effect. Like we're wearing this mask to be one person to people, but then behind closed doors, we're in pain. So we have to say, I'm hurting. That would be.
Yeah. Now we've got, I got 3 minutes and I got 2 questions I got to get through. One question is senior citizens. We're starting to see senior citizen suicide on the rise. We had a couple that was right there at Bond Hill. We never would have thought he fixed all our shoes, and it just got so tough. Maybe Kate, as it relates to policy and can't get the financial help. What's available? What can we do? Senior citizen suicide is on the rise.
I think building on what was just shared, I think that there is a really powerful training, Question, Persuade, Refer, that is QPR. And we did it at our organization. Anyone can go to a free training in our site, in our region. But it really teaches you what Dr. Thomas was saying, that you don't ask folks, are you thinking about hurting yourself? you say, are you thinking about killing yourself? Because in their mindset, it helps you understand the mindset. They're a burden to others. That's a trigger. Oh, the world, the world would be better if I wasn't here. You see this a lot with senior citizens who feel overlooked and less important than they were in other parts of their lives. That's a challenge in our culture overall. But I think really to get to be aware of those signs and use the right words so that we are being specific and clear and not listening to that voice in our head that says, oh, no, it should be fine. I mean, I noticed they're going through a hard time, but everything's okay. I won't say it. That's too awkward. Please be awkward. Please be clear. Like, we don't know, as Dr. Thomas shared.
All right. Well, I want to thank you all for being on the show. We're running out of time. Kate Schroder, Karisma Hazel, Dr. Shantel Thomas. In the chat, could y'all put where the people can reach you? Kate, tell people how they can call Interact for Health, and I know you can connect us with everyone.
Yes, interactforhealth.org, and all of our contact info is on the website there.
All right. Well, thank you, ladies, so much. We're going to have you come back. Mental health is real. It's Minority Health Month, and we are wrapping up our show. I think I hear the music in my headsets. I'm not sure. Hopefully I do. But we are wrapping up. We'll put all the information for the websites that you talked about. It'll be on our site, Alicia Reece Soul Food, Food for the Soul. Thank you all so much. And also put all your contact information, please, in the chat so you can get in touch with Karisma Hazel. You can get in touch with Dr. Shantel Thomas, and you can get in touch with Kate Schroder. Thank you so much for listening to Alicia Reece Soul Food, Food for the Soul. Until next time, there's my music. Until next time, don't forget.